All right, good afternoon and also good evening for those listening to us online. And I think in Australia we have a new day, so good morning for those who are sticking with us. My name is Karolina Mackiewicz. I'm the Innovation Director at the ECHAlliance. And I have a pleasure and honor to facilitate the last part of today's. It will be the session on green health. And I will just give a very, very quick introduction to the topic because we're switching. We heard about the data and digital. We were now immersed for 2 hours in healthy aging. And now quickly we switch the gears and we go to green health. This event is part of the UN Science Summit. And with green health, with this discussion on green health, we will touch on the at least 3 SDGs, the good health and well-being, the climate action, and also on some elements of the sustainable setting, sustainable cities. I will give just a couple of numbers so that we can put ourselves in the team and understand why we as ECHAlliance, the Global Health Connector, we want to bring this topic to your attention. I understand that in the US, this is actually already a topic that is on the agenda, and with the climate week here last week, it's became even more prominent. But we also understand that it's still an emerging topic in different parts of the world. And we as the ECHAlliance, we want to be the platform, give the space and the opportunity for the experts and practitioners from around the world to learn from each other about this topic. So what do we understand under green health? I'm sure that you're familiar with the topic of, with the One Health by the WHO, with the zero net healthcare. And this is something that we want to bring together under the green health. I'm sure that many of you know already and is aware that actually the carbon footprint of healthcare system is pretty significant, and it's bigger than aviation. And we all talk about how we should actually curb the damage done by aviation or by transport, but we don't speak that much about the healthcare sector. And we also understand that this is because the healthcare sector is a special sector, so we should be careful about touching on some of those taboos and putting more pressure on the system. But we also know that healthcare facilities, like, for example, hospitals, actually bring more pollution, 2-3 times more pollution than the regular commercial buildings. And then one more fact. We heard about the rebuilding Ukraine, there was rebuilding back better. But in general, we know that to guarantee the universal health coverage around the world in a future, in a short future, we will need around 400,000 facilities, healthcare facilities. So we can think how to build them better, how to build them with sustainability in mind, how to make sure that they are energy efficient. But also in this discussion today, we will bring some less known facts and cases from around the world. Also how, for example, electronic health records can help us bring more sustainability to the healthcare system, and not only because we will get paperless. What you see on this slide is like what we as the ECHAlliance want to touch on with the green health team. So we have of course, discuss or promote the practices from around the world to decarbonize healthcare systems, promote a green IT, of course, help develop resilient health systems, but also green skills. I was very much surprised, or maybe not even surprised, shocked, but not surprised, and that only yesterday I read that only in 18% of universities, medical universities, actually some elements of sustainability are being taught to the future healthcare professionals. So actually, like, people actually lack the knowledge, lack the awareness, and this is what we are here for, to bring the awareness to this topic. How this 1.5 hour will look like: at the beginning, I will invite the David Duncan, who is the researcher, journalist, for years writing about the issues related to healthcare, sustainability, climate, to give us a bit of, keynote to bring us to this topic. And then we will have 6 short interventions from people managing hospitals, doing research on this topic, investing in the meaningful and impactful initiatives, to let us know what they do and to help us learn from each other. And I'm sure that we will also, before 6 p.m. here in New York and midnight in Europe and breakfast in Australia, we will still have the opportunity to ask some questions and discuss this topic and also bring those recommendations to the Summit for the Future.